السلام عليكم ورحمة الله وبركاته. الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا وزدنا علما. سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. Alhamdulillah, today inshallah we begin by praising Allah subhanahu wa ta'ala and by sending peace and blessings upon our beloved Prophet Muhammad sallallahu alaihi wasallam, and bring you a subject that is related to the different levels of our practice and the way that we see what we see on the surface and what's going on in the internal realities. As you know, our religion is a multi-dimensional deen, and it can be summarized in the hadith that happened in about 80 days before the death of the Prophet sallallahu alaihi wasallam, called Hadith Jibril, in which Jibril alayhi salam, in the form of a human being, walks into the masjid of the Prophet sallallahu alaihi wasallam, and he asks him the questions, Ya Rasulullah, tell me about Islam. And then the Prophet answers him, he says, you got it right. And then he says, tell me about Iman. And the Prophet sallallahu alaihi wasallam answers, he says, you got it right. And he says, tell me about Ihsan. And Rasulullah sallallahu alaihi wasallam answers, he says, you got it right. And in each one of these, our scholars, they delve into it, and they said, as for what is called Islam, it relates to everything that's on the external. So any behavioral patterns, things that we do with our limbs, with our bodies, with our eyes, with our ears, these are all related to the outward practice of the Islam. But once the person starts to submit to Allah subhanahu wa ta'ala, there's a deeper realizations that happens in the realm of the Iman. And so to believe in Allah, to believe in the angels, to believe in the books, all of these things happen within the heart and within the minds. And then as you go deeper, there's the spiritual experience of worshiping Allah subhanahu wa ta'ala as though you see him. And if you don't see him, you know that he sees you. And this is the level of ihsan. And so today, inshallah, we wanted to draw some parallels between the spirituality and the practice of our religion. And in terms of medicine, how similar realities exist that Allah subhanahu wa ta'ala, his signs are everywhere, And so we want to welcome Dr. Habib. Inshallah, he's going to be talking to us about the human body and the skin, which is the biggest organ in our bodies, and it's the outward facing one, and then how that's a reflection of what's going on inside. And as we continue, inshallah, we'll have a discussion on the parallels with that and the deen, how the practice of the deen is a reflection of what's going on within the person's heart. Assalamu alaikum, Dr. Habib.
Alaikum assalam. So this is going to be an interesting conversation because it can lead us to so many analogies and correlations. I think it's going to be fascinating. And so although I'm not a religious scholar, I'm going to mention something that I may have learned from some other religious scholars, which I think is going to be very relevant. And before we start, I just want to introduce myself for people who don't know who we are. I'm a medical doctor. That means I'm an MD. I graduated from the University of Sheffield in the UK. And after working there for a few years, I came to America when I was fairly youngish. And I'm still young, but actually I'm a little bit older now. So, I practice medicine, but I understand that treating the symptom does not fix the problem. So I started to learn about functional medicine, understanding where disease came from. If you don't know where the disease comes from, how can you truly fix it? And what you're going to hear today will be an eye-opener for some people who believe they go to the doctor to fix the problem, which they call treatment. If you don't fix it, I don't call that treatment. And that's what we're going to discuss. Are you just treating the surface? Are you band-aiding it, or are you fixing it? And so, as a medical doctor, I think for us, we need to be honest with our clients, our patients, whatever you want to call it. And today we could make it broader. It doesn't have to be about disease, but we're going to try to incorporate some not only medical facts, but even the health issues can come from psychological, or we say supratemporal. It doesn't always have to be because of what you ate or didn't eat. Today, we're going to focus a little bit on how nutrition can really help you. So let me give you an example. So if you go to a dermatologist and you get a diagnosis of eczema, they're going to put a cream on. Generally, it's a steroid. So the steroid is an anti-inflammatory. Generally, it'll take the rash away. But if the rash keeps recurring, the treatment is really not treatment, because if you didn't fix the problem, it's going to recur. And so that's a good analogy for me to just lead into what I heard from Hamza Yusuf. He was talking about driving down the streets of LA, and he wasn't familiar with the roads, and he was changing lanes, and he turned left, and then all of a sudden he saw blue lights behind him. And when he wound down the window, there's a lot of ands here, right? A lot of ands. Yeah. He wound down the window. I don't think it's manual. I think it's electric. It's power, I'm sure. It was quite a few years ago, so I'm not sure now. Anyway, the police officer usually says something like, is there any reason you made a wrong turn? That's all. They always start with that. They know there's no good reason, but they always start, is there a reason? I have a lot of experience with understanding when you get pulled over. So we can talk about that another day, another problem. Anyway, so Hamza Yusuf said, when the police asked him, is there a reason why you made the wrong turn? He goes, no, I didn't see it. He goes, there was a sign that said no left turn on red. It was green to go straight. And he used that analogy to say, look, in the world around us, there are signs. The question is, are you seeing the signs? Are you missing the sign? So I thought that was really, really good because it's very practical. Because, you've missed signs, worldly signs, directions or whatever. And I think that when you're talking about the skin and you see a rash, you can call it a name, but do you understand the sign? What does it really mean? And of course, I'm going to elaborate on more than eczema for you because I'm a real doctor and I know a lot of interesting skin diagnosis. But I also know some diagnoses that have no root cause. But not knowing is not good enough. We must still speculate and try to get to the root of it, because for the individual with the condition, it's a very big deal. It's no good for the doctor saying, we don't know, so let's give up. But for the patient, it's a real deal and it's there all the time. So it's not acceptable to just give up. We have to, and that's what we're going to talk about, the deeper manifestations or deeper root causes of the superficial manifestation, which namely is the skin. I'll let you take over.
So we have a similar phenomena with raising children in non-Muslim environments. So when they go outside, they're exposed to certain culture, certain set of values. And when they're inside the home, they have a different set of values. And when what happens most often, parents, they don't spend enough time with their children, or they don't, teach the whys of what we have to do, but they force on the appearance of the religion. So you have to pray, you have to cover up, you have to dress in a certain manner. You can't eat this, you can eat this. And so the children, they grow up with having some of the surface rules of what they can and they can't do, but deep down, they don't know why they have to do that. So often it happens, they'll leave the house dressed up in a way to please the parents, but as soon as they get to the bus station, they're in the school bus, they take off their hijab and they become totally different people. And so this patching up, the forcing, the surface to be different while not addressing the root cause, it's actually a real problem within the religion also. And that's why the Quran, it mentions La ikraha fi din, that there is no compulsion in the religion. And our scholars, they said the reason for this is because Allah subhanahu wa ta'ala, He doesn't want people to be forced to come into something and pretend, and live a life in a state of pretense where deep down their hearts are somewhere else, And so when you do even enter into Islam, it has to be a submission that happens from the heart. It has to be from the inside. And then the outward manifestations of the prayer and fasting and all these things, these are all related to the behavior. And there are different, ways that can show up. But a person's heart has to be there. And our scholars, they say, most often the hearts become sick. And we're talking spiritually sick, right? A person may have arrogance, they may have greed, they may have all these different things. And so when the heart becomes sick, even though religiously their behavior appears to be perfect, a person might be in a dangerous state, because that could just be showing off to others. That could just be, so we have to address the root cause in the spiritual side and the physical side. So I turn it back over to you, Doctor.
You lead me very well to what you just said about leading by example. And so if you don't let the children understand, when I was younger, we weren't given the opportunity to think about it, just do it. And as we have the opportunity as parents, now we have the luxury to be able to have more resources at our hands. So it's no fault of our parents. You can do the best you can with the resources you have. We have so much resources. And one of those, Imam, is you, because you're so inspirational and you give great wisdom, but with a smile, and medicine can be like that. My analogy is this. When a doctor tells the patient you must do X, Y, and Z without an explanation, it's no surprise that sometimes the patient doesn't follow through in the same way. However, just like giving people fish or teaching them to fish is better to teach them, if you explain it and let the individual want to do it, you're more likely to get success. So, for example, if you have a diagnosis like vitiligo is a loss of pigmentation, and the dermatologist will just give you the explanation, what we call a histological explanation. That means that if you look under a microscope, this is what you find. What you find is that the pigment cells, which we call melanocytes, are being destroyed. But if you ask the question, why are they being destroyed? There are immune cells there that are attacking the melanocytes. Instead of asking the question, why, they just say, well, let's dampen that inflammation with steroids, which is either topical or oral, but topical means on the skin, and it generally doesn't work, actually. Like alopecia. Alopecia is loss of hair because the follicle of the hair, that's where the hair goes into the scalp, that's called the follicle, and from the follicle, you have the messages for cell division and your hair grows longer. Now, if the follicle is being affected or damaged by your immune cells, then the follicle will die or not function, and you will either lose the hair, or in alopecia, what happens is you have loss of some of the hair. We call them like half a hair. It's like an exclamation mark, but they're very discrete in circles. Now, the analogy of both of those is that the root is your immune system attacking the target. And yet, the doctor just wants to put a topical steroid on top or inject a little bit of steroid on top. And if they're really smart, they want to do PRP. It still doesn't work because the root is why is the immune system attacking the specific area on the skin or the specific area on the scalp? Generally, that's where alopecia tends to take place, but it can happen anywhere where there is hair. And so what the analogy here is that if you explain to the patient that there's something about your immune system that's directing those immune cells towards the cells or the melanocytes, the pigment cells, or the hair follicles, and if you don't understand what that is, then unfortunately we can't really fix it. That's the honest statement, and they should rely on the patient to go figure out something. And that's where, in our conversation, we will elaborate. But like with all these infomercials, that's a joke. This is not an infomercial. You have to keep listening if you want the answer. See, I learned that from the infomercial. I'm not going to give you the answer. I'm going to keep you wanting. Well, hopefully they'll stay, So I'll let you carry on, Imam.
Alhamdulillah. So, it's very, very interesting that the body has the capability to self-sabotage. And it's similar, in terms of a person who has a diseased heart, spiritually speaking. They're always harming themselves. And if you find in the Quran the story of Yunus alayhi salam, Prophet of God, is sent with a mission. He has a job to do, but he walks away from his job because people reject him, they turn against him, and finally when he walks away, he's shown a sign in a very severe manner. And of course, prophets, they're sinless, but if they make a mistake, Allah corrects them right away because they're example for the rest of mankind. So he gets eaten by the whale, and inside the whale, he recognizes that he actually, by walking away from his mission, by walking away from what he was supposed to do, he actually, went against himself and he harmed himself. So he makes sajda. He says, La ilaha illa anta. There is no God except you. Subhanak, glory be to you. Inni kuntu min al-dhalimin. I was of the wrongdoers. And this idea that, when you have, the spiritual problems in the heart, a lot of the times, Allah subhanahu wa ta'ala mentions, وَهُوَ ظَالِمٌ لِنَفْسِهِ. He was an oppressor over himself. Another example mentioned in the Quran was Surah Al-Kahf. There's two brothers, two friends. One of them has a big garden. He has rivers flowing there. He has fruits growing. And his friend doesn't have as much. And he's got children and everything. So they have a discourse, a conversation, and he starts bragging. And he says, أَنَا أَكْثَرُ مِنْكَ مَالًا وَأَعَزُّ نَفْرًا. I have more children than you. I have more wealth than you. Basically what he's saying is, God favors me more than you. And his friend says, it's better for you if you just enter and say, MashaAllah, la quwwata illa billah. Like instead of saying, I did all of these things, say, Allah gave it to me and there's no power except for him. He says, I don't think my garden is going to go away. And, and if it does, then I'm going to have better. So he has what they call naive optimism, right? Where somebody expects to receive a lot of good without doing any effort for it. And at the same time, he's just attributing all of his success to himself, all of these things. And his friend says, are you going to do shirk with the one who created you and you used to be a clot of blood and, you were nothing and he brought you into existence and he gave you all these things. Now you're saying it was me who did it. And, the idea is he was not able to witness the generosity of Allah subhanahu wa ta'ala that's upon him because of this idea that he has inside himself called the self. And this is in psychology, they call it the narcissistic trait, where a person sees his image and he falls in love with his image. And Narcissus was a Greek story where a guy, he falls in love with his image and then he drowns in that image, right? And so he has this grand vision about who he is and he's not able to see Allah subhanahu wa ta'ala beyond it, the one who's giving him, the one who's providing for him. So he's saying, this is all me and I'm better than you and I'm this, I'm that. And at the end, when his garden is destroyed, he says, I wronged myself, And so within ourselves, even though we want, the best for ourselves, if the heart, the spirituality becomes diseased, it can target the self and start to destroy us from the inside. And so and this is something that needs to be diagnosed and it needs to be treated. And just like medical condition, I cannot perform heart surgery on myself. I need Dr. Habib, right? Or I do have that vitiligo. I need Dr. Habib to treat. So similarly, the spiritual diseases also have its doctors and people that have studied in that field. They have knowledge about the signs and symptoms of it. They can tell, oh, this person is speaking in this manner. That's a sign of this problem. Or this person is exhibiting this kind of behavior. That's a sign of greed, or that's a sign of ostentatiousness. And they're able to diagnose and they're able to treat based on the person's, level of, capacity, their himma, they call it different things. But, a lot of parallels, but turning it back over to you, Dr.
I mean, just so many things to talk about. I was watching Doctor Strange, just, flicking through it. It's not one of my favorite Marvel movies, although I'm a big fan of many of the Marvel movies, like Iron Man. But you can learn a lot. So see, watching TV is not a bad thing. Watching movies is not a bad thing. Because when I watched Doctor Strange, he was humbled when he went to learn about how to fix himself. So he kept on trying to fix his hands because he was a hand surgeon, I believe, or a surgeon. And so he kept on going back to logic. And I think you explained this. You can't fix yourself from your own intellect. And what these spiritual Buddhists or whoever these people were that he was seeking help from, they said that you have to leave your body or you have to convince your brain to heal yourself. A little bit like what you're describing. And I'm thinking, I was telling my wife, I was talking to Sheikh Shuaib, and he was saying that if I have a body problem and I try to fix it with the bodily ways, I can improve, but I'll go around in circles. I mean, there's probably more detail than that. And then if I want to fix, I have to go above that because I have to get into my state of mind. Like, how can my mind make changes in my decision making? You can tell the story better later. And then if you have a mind problem, you can't solve it with your intellect. You'll go around in circles. You have to go higher than that. So with this doctor who had damaged his hand and he wanted to mechanically fix it, with his physically fix it, he can't do it because he doesn't have the capacity. And then so he has to go a little bit higher, use his intellect, but his intellect doesn't have the capacity either. And so what this Buddhist or whatever, this said that you have to convince your brain to believe that you can fix it. And that's how they cure people, which there will be science to prove it, by the way. Right now, we can't prove it, but slowly but surely. I just had to throw that in there, even though, I'm not watching Dr. Strange all the time.
I think we have plenty of evidence for that, Dr. Habib. The power of belief with the placebo medicines.
Well, yeah, keep going. And I'm going to tell you the percentages in a minute.
Yeah. So that when they do trials on different medicines, they give you, they have control groups, and they have people that double-blind experiments where they give people the actual, pharmaceutical thing that they made, and they give others the placebo, and they say, this is and they believe this is going to heal them. And most of them, they start having that happen to them.
Exactly.
They're taking sugar pills.
Yep. So basically, to get a drug FDA approved, what we call efficacious, that means it works, it has to be just 11% above placebo, which may not sound impressive until you understand the power of placebo. So the fact is that, 11% doesn't sound impressive, but it's very hard to get 11% over placebo. There is no drug out there that gives you a 50% improvement, let alone 60 or 70, with maybe very few exceptions. There's always exceptions, right? Certain chemo can, in children, fix leukemia 90%. These are exceptions. The majority are lucky if you get 50%. So when we say a drug is FDA approved, it's 11% over placebo, it's because placebo has been measured to be approximately 35% effective. Now, some people call it just a placebo. They call it a sugar pill. It's not nothing. It's real because it actually works. And that is something a doctor needs to tap into. And I'll give you real examples of that. Because why waste the opportunity of that 35%? Going for that 11%, right? Because it's right under your nose. You taught me that too. Our ability to get above our physical, our ability to get above the mental, our what we think is our brain power, is the spiritual. It's right above us. It's there for us to avail. We have to believe in it. That's the power of belief. If you truly believe, there are people who say I believe, but they don't really believe, and you're an expert of figuring that out. So the placebo is because it does something to your immune system that is fundamentally beneficial. So when I have patients, because I'm a holistic doctor, I'm a functional doctor, I take the time to educate, I get them involved. They have a strong belief that they will be able to get success. That alone gives me such high benefit. And then when I add metrics like understanding which blood test reveals the food that activates the immune system in a negative manner, you can stop it. When you then measure what is depleted in your body by nourishing your body can now have the means to heal itself. Then it's like going from 35%, then another 10% and another 20. So I get up to like 70, 80% success rate. I'd like to boast and say 90, which is actually true for my PRP. It's actually 95% of success, but it's so much superior than medication alone because medication has been proven to be only 11% more above placebo because they ignore the placebo. A doctor could take advantage and educate patients, motivate patients, make them believe in their doctor, right? Patients want to believe in their doctor. They want to believe the doctor is smart. They want to believe that the doctor cares. Now, even if it's not true, they can at least pretend. Come on, you just put a smile on it at least. Come on, man. Anyway, that's kind of semi-joke, but kind of serious as well. Anyway, let me let you speak, and then I'll continue on about the balance of the immune system, and then when does it turn on you? And that is the manifestation of what we call autoimmune disease. You can have a spectrum, like a little bit of vitiligo, they poo-poo it. A little bit of alopecia, they poo-poo it. But could it be a part of something bigger? Yes, it could be. What's bigger? Crohn's disease, ulcerative colitis, lupus, rheumatoid, the list goes on, and so many more without any names. That's why it's so important to understand how to regulate the immune system. It can be good or it can turn on you. So I'll let you speak.
SubhanAllah. There's a book by Imam Ghazali. It's called Kimya Sa'ada, The Alchemy of Happiness. And he likens the human self to a city that has a working class, that has the military, that has the ruling body. And he says this is like the different forces within your body. The working class is representative of the human desire. And if they become unbalanced, they become greedy, they become, very, very, but if it's like not motivated at all, they become lazy, they become, and the city will stagnate and die as a result of that. And they say the military also, it's the power to protect the city, but it can become damaging to the self. because you have coups happen all the time, so the anger, they revolt against the person. Or it's used for establishing justice, but sometimes it becomes a source of rage and destruction. And then the ruling body, he likens it to the intellect. The intellect can be sharpened, it can be informed, and it can make decisions based on wisdom, or if it can go in either extreme, become very clever and self-sabotaging, or it can become naive and gullible. And so, what's interesting is that the human body has its self-sabotage with the immune system, which is supposed to be your defense force, right? But in the spiritual side, our scholars, they talk about every single human being has been given a portion of light. And this light is from Allah subhanahu wa ta'ala. And Allah subhanahu wa ta'ala, he describes his light in the Quran. Allahu nuru samawati wal ard. He's the light of the heavens and the earth. And he gives an example of it like a niche. Inside the niche is a lamp. This lamp is enclosed in a glass and it's shining bright. And this is a very nice analogy. But there's a lot of tafsir literature on it, of course. But what stuck out to me very, very much is that they said the niche represents the human chest and the lamp represents the human heart. And the glass represents how polished or unpolished it is. If your heart is clean and polished, that light is already in you and it's shining. If it's not, then you have something that's covering it. And then Allah says, Nurun ala nur. So this is light upon light. So there's light within you that's able to recognize and see the reality. And then there's the light that comes outside. So you have the eyes that's able to see. But if you're in the dark, your worst enemy could be sitting next to you and you wouldn't be able to see him. So you have to have the light from within and the light from outside. And they said this is the intuitive knowledge from within the human being and the acquired knowledge from the world that you're living in. And so nature versus nurture, however you want to term it, right? So as you have these balanced, then it's nurun ala nur, it's light upon light. But if one or the other is concealed or covered, and kufr also means to cover, right? So somebody's in a state of kufr means they've covered that light inside themselves. They know Allah is the reality, but they ignore it and they cover it up. And so, to turn a blind eye to something because it's shinier outside. And we have the story of Mullah Nasruddin where he lost his needle inside his house and he went outside and looking for it under the lamp. Neighbor came up and said, what are you doing? He said, I dropped my needle, I'm looking for it. He said, let me help you. So they look around for like half an hour and finally the neighbor gets fed up and says, where did you drop it? He said, I dropped it inside the house. He said, why are we looking for it here? It's brighter out here, there's not enough light inside. So we have to look where we lost the needle, we have to look where the problem is. If the heart needs polishing, spiritually speaking, then the heart needs polishing. And if the actions need to be changed, the behavior has to be changed, then we have to address that. But we cannot ignore one side and say it's brighter out here. It's easier to just put on the hijab than to address the core issues of faith. Similar in medicine, Dr. Habib, you can get into the immune system.
Well, what you described is very similar to what's going on inside the body. You said that you have soldiers, they keep order or they turn and it becomes a coup. That's what's going on inside the body. The body is a battlefield, but it's in a perfect harmony, but constant chaos. But in that chaos is a harmony because there's a balance until you create an imbalance. So we call that your T lymphocytes. That's part of your immune system. And they're what we call T-reg. They regulate which ones come up and which ones come down. It's never about the good always must be up and the bad must always be down. I wanted to talk about this subject. I think we kind of alluded to it last time. High is not always bad and low is not always good. And that's a perfect example of how your immune system is. There's a time to be good and a time to be bad. When you have an invading force, it's time to turn that regulation cell, T regulation, towards killing that invasion. But there's a time to stop. You have an injury, you try to heal it, but if you continue to attack your injury thinking it's constantly injured, then you'll constantly be in a state of inflammation. So one of those examples, which is actually very apparent to so many children in the population, is unbelievable. And it goes back to a little bit what we started the topic about the skin. So eczema is a very common thing. That's why I brought up the word eczema. It's such a common thing, and they think they have a diagnosis when they call it eczema. That's wrong. Eczema is just a descriptive word. It's a dry, scaly rash, and underneath that dry, scaly rash is an area of redness, inflammation. So eczema is just a description of dry, scaly skin. It's not a diagnosis. It's like saying irritable bowel. It's not a diagnosis. It's just a description of constipation, diarrhea, bloating, gas. It's not a diagnosis. To me, means you know the root of the problem, right? Remember, we started by saying root of the problem. So these T regulation cells is related to childhood allergies. You have T helper 1, which is an anti-inflammatory to reduce inflammation. You have T helper 2, which is a pro-inflammatory. Not all pro-inflammatory is bad. When you're trying to kill an invading organism or anything invading, you need those T helper 2 to kill it. So when you have allergies or when you have a sterile environment in your childhood, there is no reason to activate your T helper 1s, the anti-inflammatories. So they become very weak. As you get older, now there's an imbalance. Very few T helper 1. So the immune system says, well, I must balance myself. I'm going to make more T helper 2. Now, T helper 2 happens to upregulate inflammation. That's why one of the reasons why people have allergies, children have allergies, is because you have made the immune system too weak when they were younger, and now when they get older, they start to develop allergies. And some of those manifestations of allergies is runny nose, hay fever, itchy eyes, but also eczema. We call it atopy. Atopy is allergies either in the skin, eczema. You can have allergies in the nose, allergic rhinitis. You can have allergies in the lung called asthma. So these are all a spectrum, a variation of this immune system that's imbalanced. It's not a disease, but it's a dysfunction. It's a dysregulation. And it reflects how your body is ready for good and bad. But if you don't train it properly, then you wonder why it turns bad. Now, when we talk about autoimmune disease and we gave alopecia, loss of hair, vitiligo, loss of pigment as the milder version, it's a little bit of that. Something about the immune system has been dysregulated. And so the body's own immune system, the immunoglobulins and antibodies are attacking those particular specific locations. That's on the milder scheme. When you have rheumatoid arthritis or lupus and you have joint inflammation, I mean, this is real inflammation, is because those immune globulins, those antibodies are now congregating, attaching to the membrane of the joint. We call it the synovial membrane. Most joints have it, like your knee has a synovial membrane. Your knuckles have synovial membrane. Your wrist has synovial membrane. Those can be attacked by your antibodies. That's why, depending on the distribution of the joints that are affected, we have an idea to make a clinical diagnosis. Clinical means your examination of what looks like a rheumatoid arthritis, what looks like a lupus arthritis, what looks like a psoriatic arthritis. Psoriasis is a skin disorder. How can we have joint problems? Psoriatic is a skin disorder. How can you have inflammation in the liver? You can. Psoriasis is a skin disorder. How can you have inflammation in the arteries leading to heart attacks? This is the point about the skin only being part of an inner complex immune system, which is true for heart attacks, which is true for dementia, which is true for a rheumatoid and autoimmune disease. That's why it's so important. That's not to say that just because you have allergies as a child, you're going to get disease when you get older. It's not to say that you have alopecia, you're going to get, but the point is the immune system is highly, highly sensitive. You have to train it. You have to keep it clean. You have to nurture it. You cannot be blasé and allow things that enter your body, invading things like infections. But then what is the biggest invasion? What you eat has to go through the gut, and some of those can go into the bloodstream. That's what I was alluding to when we say that certain foods, when you ingest them, can then attract your immune system slowly but surely more and more until it gets to a threshold. And then those antibodies are attaching to that food particle, which we call antigen, into what we call an immune complex. They travel around the bloodstream, which is everywhere. Is there a part of the body that doesn't have bloodstream? Nowhere. Therefore, it can cause any symptoms. So when your doctor cannot pinpoint a symptom or a diagnosis because it's too vague, it doesn't fit a picture, you better be sure there is something in the blood, whether your doctor understands it or not. That's why the patient needs to investigate what's going into their body. What is it that they're being exposed to? And this can be a little bit more complicated, but today we'll keep it fairly simple. Yeah. And so just to summarize, you have regulation of your T cells, your immune cells. It's called Treg. It has the ability, like a symphony, to know when to turn on, when to turn off. But if you don't use it, if you sterilize things, if you know, and we can go a little political, but we can't, because you know what's going to happen. Then you get people getting really upset. Just like religion, people don't like hearing the truth. When you tell them the truth, they don't like hearing it. They want to hear the conventional thought. You know, if you sanitize, I'm just going to keep things fairly general, but people, if they listen carefully to what I'm saying, they can add up the dots, add up things. If you sanitize everything, which is not a good thing, is what I'm saying, then you are not allowing your immune system to work. And then when it needs to work, it doesn't know how to do it. It's actually a crime for the medical profession to not understand what I'm saying. This is not something new, novel that Dr. Habib invented. This is a fact and it's being ignored. That's why they're not doing a good job of fixing allergies, atopy, asthma, eczema, vitiligo, and the list goes on and on and on, because they're not looking at the deeper issue.
Yes, absolutely right.
I better calm down.
You know,
do a dua for me. Let me calm down.
MashaAllah, MashaAllah. I love your passion. You know, when we were little, we used to play outside, you know, in the sewer, like, you know, we had like draining, you know, sewers and stuff. We used to go jump in there, find frogs, play with, nobody would get sick. Here, everybody, all their children are cooped up inside the house. They're all always on virtual, you know, games and things. Nobody plays outside. Nobody has any exposure. Everything is sanitized. Everything's washed. Soaps everywhere. Of course, the immune system, what's it gonna do? You know, and you know, drawing a parallel from the religious side of things, Allah subhanahu wa ta'ala didn't want us to have that kind of culture shock. Also, you know, especially if you're religiously inclined and you're a good person, naturally you're going to assume everybody's good. So Allah subhanahu wa ta'ala immediately, as soon as you open the Quran, He says there are people in the earth called muttaqeen, and then there are people who disbelieve, and then there are munafiqeen. This is the first description of people in Surah Al-Baqarah, that there's going to be corrupt people, there's going to be bad people. So you don't have a culture shock. You have to equip yourself with the tools you need to deal and interact with those kind of people. Similarly, like you mentioned, if we don't allow the human immune system to develop and to deal with those things, like when I came to US, I was 12 years old. All our life we grew up, you know, respecting our elders, and if parents walk in the room, we have to stand up, hands on our chest, Salaam alaikum. Teachers in school, you don't speak out of turn, you have to put your hand up like this. When I came here and went to school, I was in a state of culture shock because I didn't know what I was seeing. Kids were making fun of the teacher. It was completely new to me. But you know, take that same example and bring it down to the immune level. Is that what's happening, Dr. Habib? Basically,
yeah, exactly. Look, I mean, what we're saying is very profound, very deep, and people can take the message very clearly and make common sense out of it. But the point is that if I don't get, so people are so afraid of getting sick. People are afraid of making mistakes. You know, there's a terminology in mistake in business. It's not a mistake if you've learned from it, yes, right? If you make a mistake twice, that's a mistake. In the same way, the analogy is this, that, you know, even in religion, your mistakes, you learn from them, or better still, an adversity. It's there for you to address and respond and become better for it. In fact, if the good people will be tested, and therefore adversity is meant to be. So why is it that people are so afraid of adversity? Why are they so afraid of hunger? Why are they so afraid of the cold? Why are they so afraid of getting infected? This is what the body was designed to address, is all these types of stresses. In fact, our studies, the latest, I'm talking about 21st century, about anti-aging, about reversing disease, about reversing biological aging. It's all understanding temporary stress. When you apply temporary stress, the body activates in ways that is not possible in any other way. In other words, all the good food in the world won't compensate. All the exercise in the world won't compensate. All the vitamins in the world, all the drugs in the world won't compensate. Temporary stress is what we are finding. And let me give you an example before people think it's theoretical. So when you go into a sauna, high heat, you create heat shock proteins. Heat shock proteins actually repair your DNA in a way to activate checkpoints. So when you have damaged DNA, the heat shock protein repairs that DNA. And if you don't know how to repair it, eventually enough damaged DNA becomes mutants, and mutants then go on to become cancers. There's an example of heat stress. What about the stress of fasting? It activates longevity genes. And it does that by lowering certain growth pathways. You are going to say, well, Dr. Habib, growth pathways are good for you. Yes, and cancers love that too. So if you have a diagnosis of a cancer, you need to kind of really halt the growth pathway. What do I mean? I don't mean don't eat, or it's that at certain points, you want to eliminate refined carbs, because that activates IGF-1, which is common for all cancers. So when you're a young child, IGF-1 and eating carbohydrates is okay. But if you get older, you need to moderate it. And that's why people who have low caloric intake, generally low carbs, or who do intermittent fasting or type of keto, they will down-regulate IGF-1. That actually turns out to reduce inflammation. It actually turns out to actually reduce diseases down the line. So my point is, it's the temporary stress of fasting actually activates longevity genes, actually down-regulates the things that allow cancers to grow. You know, like sugars is a food for cancer. Well, it is because of IGF-1, right? So if you know how to block IGF-1, the best way is fasting. You know, a lot of people argue about keto. There's too much arguments. If you don't eat, you're keto. Because if you don't eat, your body's going to break down fat. That's called keto. So keto is like 60-70% fat, 20-25% protein, and 5% carbohydrates, right? So the point is that, you know, if you're not eating, then no carbohydrates, no protein, no fat, then you have to burn down your body fat, and your body breaks down fat, makes ketones, which is fantastic fuel for the brain, which is fantastic fuel for the muscles. So, and we're changing subjects a little bit. So we were talking about really that we need to understand temporary stress. And being infected is a good thing, because it trains the immune system to be ready for the next one, and the next one, and the next one. It's not like I'm asking you to go get infected. I'm just saying, let nature take its course. Do the general due diligence. If somebody's sick around you, put them out of sight. You know, close the door maybe. Put them in the basement, something like that. However, what I'm trying to also say is that you don't have to go crazy by wiping down everything that you touch, because so long as you don't touch that infected area and then touch your nose, you're okay, actually. And so the more you disinfect your skin, you're destroying the microbes on your skin. The more you have a sterile diet, you're destroying the microbes in your gut, and then your immune system will go down. So we're going to finish off on some of the do's and the don'ts of how to make your immune system stronger. So in finishing on this topic about intermittent stress, being infected is not something to be scared about. Being aware of bad infections, yes, that's one thing, but you cannot run away from every single virus. You're not meant to. You're not meant to. So, I can't say more than that. It gets politically wired, but yes. Understand. So let me give you a real example. I have somebody, a patient whose daughter is on immunosuppressants because they had a kidney transplant. And so they've been vaccinated multiple times with the COVID vaccine. And they've even had boosters multiple times, and yet the antibodies haven't risen. So I just suggested to the parent, vaccines, I'm not an anti-vaxxer, I'm just going to make the statement. I'm a real MD. It's the right treatment for the right patient at the right time. That's my trademark, by the way. Dr. Habib. Yeah. However, that's a very good statement because it's the right vaccine at the right patient at the right time. So we can go, it's not about pro or anti-vaccine. I'm just giving you about a real example of somebody who's sitting in my office, the parent, and he was explaining, he was upset and worried about, what's this explanation? My daughter's got the vaccines, got the boosters, and the antibodies are not showing up. I said, listen, the vaccine is supposed to provoke the body to make antibodies. The vaccine is not the antibody. If your daughter doesn't have the ability to make her own antibodies, the vaccine can't boost it. Maybe you should think about making the body a little bit more healthy, which is a conversation that has been lost in all this immune discussion about all this vaccination, which you can't cure yourself with vaccinations. You can do a much better job of making, we're called the host, making our own host defenses stronger because you have more control over that. But this poor girl who's under medical supervision from Johns Hopkins can't seem to explain to the parent why the antibodies are not up. I can give you the answer. The antibodies are not created by doctors. The antibodies were created by Allah, of course, in your body, for God's sake. So you cannot do this with medicine. There's very few, there is chemo medicines, but we're talking about general stuff. Okay? So this kid doesn't have cancer. They're not going to use it, but you could stimulate immune cells from the bone marrow. It's called GSF stimulators. Anyway, so what I'm saying here is that if you combine the concept of both, because a person who's had a transplant actually does need the vaccine because they're compromised. They are more likely to catch the virus and proceed to becoming hospitalized and have a higher chance of death. They are actually the category that needs the vaccine. So for people that don't think I know about my vaccine, but your vaccine is unlikely to work if there are no antibodies. You've got to combine natural ways to help that individual make their immune system stronger. Then the vaccine can come in and trigger and stimulate. And that's what, so the vaccine can be described or observed as a temporary stress.
Yep.
And why not? You get the vaccine and you get sick for a few days. That's a good thing. That was a temporary stress. But it's actually, they've introduced something which put the body under stress. Then the body responded to it, right? So it's so many analogies to it.
Yes.
But I better stop talking, otherwise we'll be here all day.
No, this is beautiful, Dr.
Up to
Habib.
you, my friend.
I was going to bring that up, but I wasn't sure if you wanted to talk about this because so much politics around it.
But we just talked about common sense stuff, really. So
yeah,
we gave real examples of real people. And so nobody can argue that, frankly.
Yeah. And what's interesting in Arabic, the word for intellect, nuha, also means somebody who's able to stop and think. Right? And if you're living in an age where there's a lot of information being thrown at you from every direction, critical thinking is very important. You have to step back, and just because you're exposed to a lot of information doesn't necessarily mean your knowledge is going up or you have a better understanding. You have to make sense of what's going on, and is this the truth? Is this not the truth? And like in Islamic traditional medicine, medicine requires wisdom. And same as with the spiritual traditions, the sheikhs, they didn't give the same dhikr to every person. Like we have a story about this sheikh. He was a very, very devout spiritual leader. He was a murshid. He was guiding people, and he had students, and each one of them, depending on their state, he would teach them certain type of dhikr to make. And for one of them, he was teaching him, every time you want to make a decision, ask yourself, are you sure? And repeat the word, are you sure, 100 times. He said, okay. So some student who's in trying to increase his knowledge, he was eavesdropping and he heard the sheikh's instruction to the student saying, are you sure? Are you sure? But it happened to be that this guy, he used to work for the king and he was part of the military and he was supposed to receive the king's orders for military actions. So he started practicing this, are you sure, dhikr. And the king tells him, gather the soldiers and attack this place. And he tells the king, are you sure? And the king says, I just gave you a command to go and do that. And so gather the soldiers. He goes again, are you sure? And the king says, take his head off. So for one, it was a medicine. For the other, it was a cause of his demise. And so, it's we have to know the complexities and the dynamics of what's happening before we start prescribing things.
It goes back to what I said, the right treatment for the right patient at the right time. Now it's all cookie cutter medicine. You have hypertension, you're going to get the same class of medicine. They're not looking at the right patient at the right treatment for the right patient at the right time, with a few exceptions. In the same way, every diabetic is treated with the sugar. They fail to understand that insulin resistance, which is related to inflammation and toxicity and fatty liver, they fail to understand that that's the correlation. So you can't treat every sugar problem the same way. Like you just said, the right treatment for the right patient at the right time. So in closing, I'm going to tell you this. The two of the most fundamental things to solve, like you give very good, simple ways to solve people's dilemmas. In medicine, it should be simple. Simple, at least for the patient to understand. Number one, don't put things into the body that create harm. Sometimes you already know from general knowledge, and sometimes a blood test can show you these things, because certain foods create those immune reactions. That's harmful. Eliminate the food, and not only can you reduce joint pain, you can reduce eczema, headaches, you can reduce irritable bowel symptoms, you can actually lose weight. The other one, so one is eliminating the things that are bad for you, then the body would fix itself. Then number two is when something is deficient, replace it. Your body is more than equipped to know how to take care of itself. So when your B vitamins are low and you replace it, your mitochondria will have metabolism through the Krebs cycle. When your antioxidants are low, if you replace them through fruits and vegetables, so food first and then maybe supplementation. Well, more than maybe, but anyway. Then your body knows how to activate the immune system, because high antioxidants can reduce oxidation. Oxidation is one of the pathways to damage the body, right? We actually have the mechanism in the mitochondria to make excessive oxidation when we're faced with an infection. Just as easily when there's no infection, we downregulate it. That's why people that have things like chronic fatigue, you have to look within. You can't just look outside. Outside triggers, then inside activates. If you don't know how this vicious cycle goes, then you're going to be in trouble. Those are more complicated concepts. The simple concept is if you have low amino acids, replace them and you'll find that the gut becomes stronger. Your endurance becomes better. Amino acids are for hormones as well. It's not just for muscles. I just pretended like I have muscles. And then, you have minerals. Minerals not only make bones stronger, they actually make your body into what we call an alkaline state. An alkaline state is somebody that lives at a pH that's above 7, just slightly. That is conducive to detoxification. That is conducive to lower inflammation. Let me give you the opposite. When somebody is acidotic, that means their pH is less than 7. That is synonymous with diabetics. That is synonymous with 90% of adults, because I measure these things. And those are the people that have inflammation. Those are the people where you can't control the diabetes. They have more incidence of cancer. So what we're saying here is, number one, if there is something that is hurting you, stop it. If there is something that's deficient or deficient, replace it. And your body can take care of more than 50% of all the problems. And that is something that the conventional doctors refuse to educate the patient. They believe they want to go straight for the 11%. They have overlooked the power of convincing the patient that they can heal themselves, because they don't believe that the patient can heal themselves. That's arrogance at the highest level, especially because these arrogant doctors, they can't even help themselves because they don't even believe in the power of self-healing. And such a tragedy.
That's true.
Such a happy note to finish on.
Well, we ask Allah subhanahu wa ta'ala to make us wise people and to help us evolve this field with the help of you, Dr. Habib, and people like you, so that the future generations have better medicine and less sickness and better, healthier lifestyles. And this is in line with the prophetic tradition of the Prophet sallallahu alaihi wasallam. He told us, "Ibadanika alayka haq," your body has a right over you. And so taking care of ourselves is an act of worship. So we ask Allah subhanahu wa ta'ala to make us of those who are foremost in this regard, and increase us in knowledge and wisdom and understanding, so that we can take care of the amana that He has given to us, and grant us good health in dunya and the joys of akhirah. Ameen. Jazakallah khair, Dr. Habib.
Next time, we'll, inshallah, some topic in 2 weeks' time.
Inshallah ta'ala.
Look forward to it. Take care. Assalamu alaikum.
You too, inshallah. Assalamu alaikum.